Hi, my name is Christian Friley, and I am here representing Regis College as a graduate student in the Women's Health Nurse Practitioners Master's Program. I'm here to discuss House Bill 24-1075 regarding the analysis of universal health care payment system for the state of Colorado. This bill essentially entails creating a universal healthcare payment system for the state of Colorado, along with the creation of an advisory task force that is aimed to advise the Colorado School of Public Health in performing that analysis of draft model legislation concerning statewide universal healthcare payment system. The task force would essentially serve as an advisory committee for the Colorado School of Public Health during this analysis. Of course, the creation of a universal healthcare payment system for the state of Colorado is a huge undertaking and would require not only the advisory from a task force, but that task force would be made up of major state representatives such as Governor Polis, etc. A universal public healthcare system is greatly needed, as our current healthcare system is inequitable. There are creating disparities for vulnerable populations. It's cost prohibitive, and it's essentially not set up to respond to economic crisis. This employer-supported coverage is unstable, and therefore putting social determinants of health not as the priority, and creating gaps in care. An example being during COVID-19, millions of people lost their jobs, and what was not discussed enough is that they lost their jobs and they lost their health care coverage, preventing them from getting health care when needed, completely destroying their access to quality health care and testing resources that could have been leveraged, but weren't able to be leveraged due to the lack of coverage. Once they lost their jobs, of course, they lost their health coverage. Other countries with universal health care coverage, they're able to leverage those resources to provide testing to citizens across the populations, and they are even able to expand their coverage to support vulnerable populations. There are so many vulnerable populations in the United States that are riddled with healthcare disparities due to lack of access, inefficient cost. They can't afford health care, or there's language barriers, and they don't know how to access or even work the system to obtain needed health care. With universal health care in place, facilities are able to focus in on preventative health practices, and those practices are sustainable for all populations. And then they're able to address and really focus on social determinants of health. Our current system in the United States promotes high spending, lots of competition, and honestly, data supports that our outcomes are poor compared to other countries in the world. Physicians and providers are ordering unnecessary blood work, unnecessary imaging, that's not necessarily beneficial to the patient's health, nor will it alter their care plans in a positive manner or produce more positive outcomes, and that is driving up spending tremendously. So long story short, I am here in support of House Bill 24-1075 regarding the analysis of a universal healthcare payment system for the state of Colorado. And I do support a task force being created aiming to advise the Colorado School of Public Health in performing that analysis, because I do feel strongly that a universal health care system in this state would benefit the majority of the population, if not all of the population, providing fair and equitable access to quality health care at a reasonable price that families can afford. Again, my name is Christian Friley, and I have provided my contact information if you have any additional questions. Thank you for hearing my testimony.